observance of CAF etiquette, maintaining healthy lifestyles for added resistance against infection. Maraming salamat.
May oras po tayo sa kaunting katanungan.
Hi sir, good morning. Sir, just a clarification on the death of itong first COVID-related case natin. Did the patient have underlying or pre-existing health condition? And number two, sir, yung patient po initially nag-test po siya negative and then nag-positive. Tama po ba?
Yung sir, walang underlying conditions. Although yung nakita nga, ang nakita lang sa kanya nga yung pneumonia. Pero aside from dun sa coronavirus, meron din siyang positive na Haemophilus, meron din Klebsiella. So may iba pa na mga virus at saka bacteria na nakita. Hindi siya nag-test negative previously. Ito yung first test sa kanya yung ginawa sa RIT.
So sir, itong
Kung lang, nililawin lang natin kasi medyo baka malito. Yung tinutukoy mo yung namatay.
Yes.
Yung namatay, batay sa RITM, meron pang dalawang mikrobyo na natuklasan doon sa pagsusuri sa ibabaw ng nCoV. Meron pong Streptococcus pneumoniae, which is a common cause of community-acquired pneumonia, and also Haemophilus influenza type B. Yun lang po.
At this point, sir, na-determine na ba, sir, kung yung his death is pneumonia?
Mahirap na because it's a mixed infection, mixed pathogens. So it will be very difficult which among the three. But still, we would say that the severe pneumonia must have been caused by the corona and COVID because of the clinical and some diagnostics that show similarity between the SARS-CoV and the nCoV. Yun lang.
Sir, follow up lang sir. Sir, ibig sabihin, ito yung first test niya. So hindi po siya tinest kasabay ng first confirmed case.
Hindi siya tinest kasabay ng first confirmed case. Yung pinadala sa Australia na 6 noon, kasama yung dun sa babae. Hindi kasama yung sa lalaki. Yung sa lalaki tinest dito sa RIT. Pagka-set up ng labs natin.
Sir, bakit hindi po sila sabay?
Yun kasi nung unang, yung preliminary testing nila, ang mga resulta nung sa babae parang mas suggestive of nCoV. Kaya nung pwede kami magsingit ng isa, ang naisingit yung sa babae. Pero yung sa lalaki dito na tinest. Pero yun ang unang test niya for nCoV 2019.
For clarification, it was mentioned that he was already, tama yung kanyang sample dun sa unang pinadala dun sa Australia. Bakit hinintay pa? Kasi parang lumalabas na parang compared to the woman, although you mentioned na telling din yung sa babae, pero meron na rin sakit yung lalaki nung na-admit siya sa San Lazaro Hospital. Bakit hindi siya na-isa?
Nakapila talaga siya. Talaga siya yung...
Apart from the fact, sorry sir, apart from the fact na they are partners. So, kumbaga, kung may telling na yung sa babae, di ba dapat?
Yeah. Yung tinanong din namin sa RITM, yung kwento niyan. Kasi nung una talaga, hindi kasi sila yung mga unang mga pasyente natin. Sabi na sa Australia na magpapadala tayo ng 6. At mahirap kasi ang coordination dahil mga infectious samples ito, no? So hindi ka pwedeng magiging 8 bigla or 7 ang papadala. So nung ipapadala yung 6, nakarelista na kung alin yung 6 na yon. Kaya lang nung nakita nga yung resulta nitong dalawa, mas mukhang mas malaki ang chance na mas positive yung sa babae. Doon sa lab results lang, hindi kasama yung clinical findings.
Ano yung pinakita ng babae na masasabi na mas telling yung kanya?
Meron nakitang
na,
parts ng virus na possible na coronavirus. Talaga yung test niya na
I mean, what was the manifestation in
No,
her?
it wasn't clinical.
May
Hindi
sakit ba?
clinical yung decision. It was a laboratory decision.
Okay.
Based on laboratory results, not on clinical results.
May dagdag lang ako. Circumstantial evidence, no? Tama yung sinabi niyo, mag-partner, magkasama. Yung index of suspicion mataas. Kaya yung management is the same as for real nCoV pneumonia. That was already our assumption. Okay? Kasi yun ang importante doon, how are you going to manage it, di ba? So we were already assuming na malamang nCoV na rin ito. So yun yun.
The patient was managed as nCoV.
Yes.
And nakasunod talaga siya sa pila sa test. And he was the first to be tested.
And the only reason why his sample was not sent to Australia was because talagang 6 lang yung allotted slots.
Yes.
So that is the only reason.
And he was number 7.
Pero kung tatanong, sir, yung manifestation nila during the time when they were admitted in San Lazaro Hospital, makikita ba yung difference? Pareho ba silang may lagnat? Or talagang clinical or laboratory test lang ang nagsasabi kung bakit kailangan unahin yung babae? Dun sa manifestation
Yung
nila,
laboratory test ang nagsabi kung bakit inunahin si babae.
pero yung ano yung manifestation nila during that time when they were admitted? Pareho ba silang nilalagnat?
I think we already said that, Maris, di ba? Yung babae inuubo lamang, yung lalaki nilagnat. Pero yung laboratory test ang decision nila ng RITM, kaya yun ang inunang isip. At sinunod agad yun sa lalaki.
Sir, ano na po ang SOP sa pag-handle ng namatay sa NCOV-RT? May capability pa rin ba siya mag-transfer ng virus to others, especially yung mga nagtatrabaho sa funeraria?
Well, ang standard procedure natin is to, of course, dispose otherwise the body as soon as possible. At sa ngayon, ang hinahandle pa rin natin, of course, as potentially infectious yung cadaver and being treated with care. And of course, the cremation will be done as soon as possible.
Sir, yung chronology lang nung sa death, like yung dates, kailan siya unang na-test, kailan lumabas, and then kailan po siya na-diagnose with pneumonia. And yung isang question ko po, yung sa hospital's readiness, ilang hospitals po yung may negative pressure room? Ilan yung may
Hindi naman
isolation? May
kailangan ng
capability?
negative pressure room.
So, may capability?
Sabihin, hindi kailangan, ano ba yung
Negative pressure isolation. Regular isolation. Negative pressure.
Ay, negative pressure. Oo, hindi naman na kailangan. There is really no indication that is needed. Ngayon, yung tinatanong yung mga dates, that's very granular. We can just invite back the SLH sa Lazaro Hospital para masagot. Kasi hindi naman namin maalala yung mga dates. Marami kaming iba rin iniisip. So, pwede namin ipa-interview sa inyo si Dr. Solante, Jean Solante, at saka si Dr. Dodi Lopez.
Sir, yung yung sa regions, kasi kukalat, anong mga DOH hospitals yung referral sa regions? Saan nila pwedeng dalhin yung capable na mag-handle? Kasi hindi yata
Lahat ng DOH na medical centers, level 2 and level 3 hospitals, ay capable. No? Kasama po yun sa licensing requirement natin. For a level 2 and level 3 hospital, that you should have the isolation facilities to be able to handle infectious cases. So lahat po ng DOH hospitals na regional hospital and medical centers, maaari nilang puntahan.
And sa isang hospital po, ilang isolation room yung required?
Iba-iba po. Anywhere from dependent kung sa specialty ng hospital. At least 1 or 2 per hospital. Pero katulad ng RITM tsaka sa Lazaro, of course, mas marami.
Wait, Director, dito po. Kamusta na po yung contact tracing? Yung naka-interact po ng yung two confirmed cases?
As of today, meron na tayong nakuhang 74 na contacts nung dalawang pasyente na positibo sa nCoV. At sila po ay nabigyan na rin ng nararapat na advice kung anong gagawin nila with regards to home quarantine. Gusto namin linawin ang home quarantine na sinasabi natin. Ito po ay parang isolation lang din sa loob ng bahay. Ibig sabihin, wala silang privilege na makipagkalubilo sa miyembro ng kanilang pamilya habang binabantayan po sila sa loob ng 14 days.
Secretary, although fake news yung nitong weekend, yung nakakahandle sa Igao, doon sa Manila, pero in case po na totoong may ganon, na nangangatog na siya, napukumpulsyon, at meron po possibility na may NCOV, ano po dapat yung gagawin? Sino po dapat ang
Ang first responder mo dyan, usually, police. Kasi yung police, nag-roving sila eh. So, after the police, tatawag yan sa pinakamalapit na local government hospital, sa emergency room. Meron tayo rito ang emergency. Pagpadala kayo ng ambulance. At pwede bang dalhin sa ER ngayon? Pagdating sa ER. Pero ang problema mo nga, dahil unconscious, aantayin mo na manumbalik yung kanyang malay tao. At the usual, mag-i-interview ka at yung ating assessment tool, yun ang paiiranin natin. Yun ang gagamitin natin. Pero titignan muna kung meron symptoms. And then, you have to be guarded. Okay? Pero fake news.
fake news?
Yung muna hindi pa nakatanong ulit. Sige.
Sir, dun sa ABPU,
dun sa PUI na reported today, may nakitaan tayo na sa contact tracing, may nagkaroon ng may sinyales ng symptoms ng ubo at sipon. At ito ay nakasama na sa bilang na ating rinireport nila. Walo.
Next question. Wala na. Rafi, we have 2 more questions.
Meron ba po bang parang quarantine facility ang DOH para kung sakasakaling may mga dumating pa? Kasi parang kahapon lang naman na-impose yung ban, sir, no? Pero kung may dumating pang galing sa SAR or China mainland, saan po dadalhin yung mga pasyente or yung mga Chinese kung sakasakali? And
Babalikin sila, syempre.
so hindi na sila ipa-quarantine dito, sir?
Chinese nationals, since yesterday po lahat ng Chinese, actually foreign nationals coming from China, it was immediately implemented by the airport authorities at immigration. So wala na pong nakapasok, binalik po sila sa pinanggalingan nila.
Pero do we have a quarantine facility if in any case hindi pwede sa bahay or
For aling pasyente yung pinag-uusapan natin doon?
Quarantine facility
Or-
in general? Of course, the isolation in the hospitals if they're asymptomatic. But what you are probably referring to in particular is the planned repatriation of about 40 to 50 Filipinos who are now in Wuhan. Is that the correct way to rephrase the question? Okay. Now, we are going to present the options during the task force meeting with President Duterte tonight to give us the guidance, because I'm not yet at liberty to tell you what these options are, what these quarantine facilities may be. But suffice it to say that we need to prepare everyone, even the communities where the quarantine facility will be situated.
Sir, balikan ko lang yung dun sa case nung namatay na patient. Kasi base dun sa timeline na binigay kahapon, parang gumagaling na to na patient. And yet, namatay siya sa severe pneumonia. Ito ho bang pneumonia niya, hospital-acquired pneumonia? Because yung sa streptococcus pneumonia nga yung nakita dun sa lab results.
Well, mukhang community-acquired talaga na mixed infection. Pero tama ka, Jovic, na yung parang last 3 days, medyo stable yung pasyente. Kaya lang biglang na-deteriorate yung kanyang condition. Of course, gumagawa pa rin naman sila ng clinical audit ngayon sa ospital para mas examine kung ano yung nangyari at saka intindihin. Pero ang pag-report sa atin ay parang community-acquired yung pneumonia.
In terms dun, sir, sa cremate ng body ng patient, ano na po yung update dun sa...
Well, sinischedule na namin yung kanyang cremation, and siyempre lahat ng precaution gagawin naman natin para sigurado na walang possibility ng exposure ang kahit sino na ma-involve during the cremation. Ay po.
Sir, para mas malinaw lang po, kailangan natin pwedeng sabihin na talaga pwede nang lumabas yung isang PUI and yung isang na positive na asymptomatic na or bumubuti na po yung kalagayan.
Dalawang negatibong test results ang kailangan natin. Yan ang as a protocol, yan ang standards. Kaya yung babae na iniulat natin nung una na first case of nCoV, hindi pa rin natin pwedeng paalisin dahil hanggat hindi na-satisfy yung 2 negative test results, saka lang natin siya pwedeng paalisin.
Sir, yung kung ano, sorry.
48 hours.
May time frame ba yun kung kailan yung susunod na test dapat sa kanila?
24 to 48 hours between the 2
Ang
tests.
interval.
Yes.
Follow up lang po dun, sir, dun po sa mga PUIs na nailabas na sa ospital or mga po pwede self-quarantine. Pero hindi pa po sila pinapaiwan na makisalamuha sa mga tao.
Ikaw na kaya?
Yung mga pinauwi ng 10, although we are encouraging them to still be conscious ng kanilang kalusugan, pero sila po ay na-clear na at ang base sa kanilang laboratorio, negatibo sila sa nCoV.
Huling tanong.
Sir Johnson po, from Visit. Yun po bang quarantine area na ipinukonsider sa Port Magsaysay? Final na po ba yun? At saka, yun po bang Pilipino daw na galing from Taiwan, are they required for a self-quarantine?
Doon sa una mong tanong, wala pang hindi pa yan finalized. Kasi nga, gaya ng sinabi ko kanina, ibibigay kay President Duterte for his guidance. Kung 4 months sa iba, or there's also an island being considered for the quarantine facility, but there is nothing definite. But yung pangalawa naman, sa Taiwan, we will have to make the adjustments in the Interagency Task Force on Emerging Infectious Diseases. We will convene this afternoon. So this is one of the considerations.
Sir, sorry pangako lang. Sa Thailand kasi meron daw nakita na apparent success in treating NCOV by using drug cocktails.
HIV, AIDS.
Oseltamivir with lopinavir and ritonavir. And apparently, yung nag-positive daw initially sa NCOV within 48 hours ay bumuti ang lagay. How are you seeing this, sir, as a possible cure for NCOV?
Well, mukhang this is a combination of antiviral. The oseltamivir has been proven to be effective for influenza A virus, AH1N1, and the all other types of influenza A virus. Now, the other two that you mentioned, they are for the HIV/AIDS patients, no? But if they say that there seems to be an improvement after 48 hours using this, that is probably anecdotal, as Yusek Eric is saying. Anecdotal because you have to remember that there are 80% of cases now in China are considered mild. And so the possibility that they are recovering very quickly is very high. 21% severe. So baka yung nakuha nilang pasyente, ito yung andun sa mild. Kaya siguro nagpapakita ng signs of recovery concomitantly with the combination therapy. But there is no hard science to prove this anecdote or this theory. It's a theory they're saying. So let's wait. WHO, I and Rabi discussed that lengthily yesterday. So there's no science to prove it as of this point.
Sir, so pag matindi, pag severe, parang hindi pa siya.
Yeah, yung sa...
You cannot say.
Wala, it's really hard to say. It's inconclusive. There's nothing.
Last 2 questions, Aiko and then please. Sige, Aiko. Talagang last na talaga ha. Meron pang sikong kami sa taas.
Last test.
Yung Secretary and Doc Chito po, it is clear now na wala pa pong local transmission at walang naihawak pang Filipino strain.
Yeah, it's very clear and I categorically state that two are imported cases. And the one who died is on statistics for China. Okay, that's not for us because ours, zero local transmission.
And the last question.
So we're just receiving information that meron daw isang patient dinala sa isang private hospital in Pasig City. And then showing all signs or symptoms, and then the patient refused to be admitted. Pwede po ba yun? Or does the hospital reserve the right to hold the patient if the patient refuses to be admitted?
Since you have paltry information, it's very hard to answer that question because we need more information to make any suggestions of whether there is a breach of protocols. But obviously, we are bound by the law on the Disease Notifiable Act. And if this particular condition fits in the category or the criteria for which you consider it as a notifiable disease, then it's their duty to report. Pero kung, well, let's keep it at that. We don't have much information.
And in cases like those, sir, the hospital can hold the patient?
Yes, they can. They can.
Okay. See you tomorrow. Thank you.